Hi, I'm Danielle.
And I'm Joe.
And we're Double Baggin It.
Two best friends.
Without buttholes. He has Crohn's disease.
She has ulcerative colitis.
And we both have ostomies. I started getting sick when I was 17 years old. And unfortunately, I was misdiagnosed with a gluten intolerance for around 6 years. After becoming more and more ill, going to the bathroom several times a day, being very sick, I had a colonoscopy, which properly diagnosed me with severe ulcerative colitis back in 1999. Fast forward about 8 years. In that time, no drug, no medication, nothing was working for me. So I opted to have my ostomy surgery, and I have a permanent ileostomy that I had done in 2007, and life is great.
I was diagnosed with Crohn's disease in 1993. It took me about a year to get diagnosed. Over the years, I've had almost every medication probably that has been created to treat Crohn's disease. High doses of steroids, biologic drugs when they first hit the market in '98. I've had 2 intestinal resection surgeries prior to my full proctocolectomy in 2012, which left me with an end ileostomy, permanent end ileostomy. And as Danielle said, life is great.
Joe joined me in the Barbie Butt Club.
Yes, 2 cheeks,
no hole, just
all
for show. Joe, how did we find out about the Patient Coaches program?
We found out about the Patient Coaches program. We were at a regional United Ostomy Association conference in Virginia, and the 11 Health booth was set up there, and we met Karen and Maggie, and they were recruiting patient coaches.
Yeah, it just was a perfect fit, and it was amazing. I know for me, it would have been super helpful when I had my surgery to be able to talk to somebody who was similar to me and had a similar health background and health journey. It would have been amazing to ask just questions about ostomy life. So I feel that the Patient Coaches program has so much to offer. I know I would have really enjoyed that back in 2007.
Yeah, absolutely.
So I'm very happy to be a part of the program.
Absolutely. I am as well. Danielle.
Yes, Joe.
How has having an ostomy changed your everyday life?
My ostomy is my BFF. I had no life with my ulcerative colitis, meaning that I was tethered to the bathroom for days on end. Going to the bathroom 20 to 25 times a day was no fun. So my ostomy has not only saved my life, but it has given me back my life, and I'm able to do everything that I could do prior to getting sick with IBD, and I can actually do more now. So I get to hang out with my family, I get to travel, I hike, I swim, I do all kinds of wonderful things. So I'm super, super pumped to have my ostomy because it's amazing. Joe?
Yes?
How has having an ostomy changed your life?
Prior to my ostomy surgery, I had really bad rectal Crohn's disease, so that was very painful.
That's no fun.
Unlike you, I didn't have the issue of going 20 times a day, 25 times a day, but it was very painful every time I went, and I had really bad urgency issues, so many accidents and things like that. So not having that has been great. Not having to sit on a public toilet in 6 years is amazing, but it has given me the peace of mind from a Crohn's perspective. It's the first time in all of my time living with Crohn's disease that I've had my Crohn's in remission, and that seems to be a result of the ostomy surgery. Not that that happens for everybody, but for me, it's the first time for surgery I've had that the Crohn's hasn't come back full force within 2 years, so that's been amazing.
High fives. So sometimes we're asked what our best hint or tip or trick is for new or current ostomates. And I'd say that the biggest tip is to just go out and live your life. For me, it was a whole new chapter. It gave me my life back. Don't be afraid, get out there and do all the things that you did before and all the things that you haven't done before that you want to do. Now is your chance. Don't let your ostomy stop you. It is a new chapter.
My biggest tip I could give to a new ostomate is, take it a day at a time, but measure your progress over weeks and months. It takes time. It takes time for your body to heal. It takes time for your body to adapt, both your body and mind, but you will get there. It's a marathon, not a sprint.
I like that. I like that. So I think that's all we have for you guys today. Stop by and say hi anytime. Rock out with your bags out.